Hey, this is Tonya from Star for Brooklyn, and this is our first ever virtual panel. And boy, do we have a topic for you. Our topic today is Sex in the City with COVID-19. Look, this pandemic has been disruptive in our lives in so many ways, but one way that people are just not talking enough about is how it has affected our sex lives. Whether we have partners or we don't have partners, the need for intimacy is important. And so we have put together this incredible panel to discuss just what we can do to stay safe with our sex in the city with COVID-19. Our first panelist is Dr. Jamila Youssef, who is our medical director of the Star Health Center and also an associate professor of medicine, both at SUNY Downstate Health Sciences University. She has so many amazing accomplishments in her life, and I just wanted to pick one of them to add on here, that in 2013 she became a fellow of the American College of Physicians, which is a big deal if you are a doctor. And then our next panelist is the incredible Michelle Lopez, and if anyone's ever met Michelle, you know why I call her incredible. She's one of my best friends and one of my most valued colleagues in terms of the work that I do. Michelle is currently the Healthy Aging Specialist at GMHC, which stands for Gay Men's Health Crisis, if you don't know. And as a public health patient advocate, she focuses on HIV, of course, but also sexual health, seniors and other populations at risk, older LGBT clients with HIV. She is just amazing. I'm so happy, and she's very pro-sex. And then our next panelist is Fleur Yvette Dikain, and she is a fitness instructor. If you Google, you'll see these amazing pictures of her doing bodybuilding. And she's also a service professional. And how I got to meet her was through a conference where we were talking about women and sex. And she is a PrEP advocate, and she speaks about using PrEP and about knowing your status and having safe sex. She's really quite amazing. I'm happy she's here. Another one of our panelists is Damian Bird, who is a friend. He is also a PrEP specialist at the HEAT program at SUNY Downstate, and he is currently working on his PhD in the School of Public Health. Very proud of Damian. And then we have the incredibly talented Jose Iorio, who is our media and marketing consultant for the STAR program. He has been a creative director, a host, and an actor, but basically Jose is what makes the STAR program magic. He is an expert in visual arts and image and graphic design, and anything that we've done with the STAR program has Jose's fingertips all over it. And I used to live in Venezuela, so I found it was kind of cool that he moved here in 2003. Jose's amazing. And then we have Tracy Griffith, who is essential to our clinic. She is the HIV prevention program manager in the STAR program. And she is, in particular, she focuses on PrEP and PEP and making sure that individuals get PrEP or PEP if they need it. So before we go on to the panel, there were some things that I said, and I just want to make sure that everyone understands. There are two things I just want to define for folks about COVID-19. We call it COVID-19 or the coronavirus, but just to be clear, these two terms are synonymous, and what they're referring to is a respiratory illness that was first detected in late December 2019. It is highly contagious and is spreading rapidly through our community, as you know. Asymptomatic is another term we're going to use and discuss, and that means when you have the disease or an infection, that you are not showing signs of that disease or symptoms of that disease. So you can be asymptomatic, but you have the disease of COVID-19, but you're not showing any signs, and therefore you can pass the virus on to others. And then finally, we have PrEP and PEP. PrEP, P-R-E-P, stands for pre-exposure prophylaxis, and this is an HIV medicine that if you take consistently as you should, that it can reduce your chances of getting HIV if you're exposed to HIV by 98%. This is our biggest weapon against HIV and fighting against new infections. And then there is PEP, which is referred to as the post-exposure prophylaxis. And this is taken in emergency situations when you have been exposed to the virus. You just find out, I believe within 72 hours, you can come and get this medicine and you take a particular regimen, a particular course to help fight off the HIV virus that you've been exposed to. So these are a couple of things that I want you to know about and make sure that you understand as we go into our panel, which is right now. Bye. So guys, thank you everyone for making time out of your busy schedule to come and talk about what is going on with Sex in the City and COVID-19. So first I just wanted to start, maybe we can kind of go around. I can see sort of the overall view, but I'm gonna probably just call out people's names since it's not really clear what the queue is. But I'd love to hear briefly from everyone, just your initial thoughts about what this pandemic is doing to sex and sexuality, and if you feel comfortable sharing about sort of what's going on with you, if you're single or if you're married, we would love to hear that. So Fleur, would you like to start us off?
Hi, everyone. My name is Fleur. Thanks for having me, Tonya. Hi, everybody. I am single, and yeah, this has been honestly. I wouldn't exactly even know where to start, but I will say this: this has definitely added another layer to the need or the want of having a partner really know what their status is, because I just feel like it's another level like layered onto the whole situation. It's like, okay, so have you been getting yourself sexually tested is something you've already been dealing with, and now it's just like, okay, are you asymptomatic or are you whatever? Like, we're all locked in right now, so everything's on pause. You try online dating with people, and that's a whole nother situation. You got some people who are like, well, can you just come over and cuddle? And I'm like, I don't know you. Like, I don't know. When this started, I thought, okay, cool, maybe we'll be able to get back to just talking to each other, right? And maybe just establishing a connection. Or maybe we can get our like little freaky deaky on or something, right? Like maybe I'll be able to like work on our vocabulary, like practice some talk or anything. But no, I don't know if it's my settings on these apps or if it's just the situation, but it's like it didn't change, it just kind of upped a level, if that makes sense. So I got toys. I got
Good
toys.
for you. Thank you.
Ready to jump in.
Oh, I would like to say I am taking PrEP daily. I'm still taking it now. But what has also come into play with this is I've also lost all of my jobs, which means I've lost my health insurance. So I'm sitting on about half a bottle of PrEP pills trying to sign up for health insurance right now with the affordable health care, trying to figure out if there's going to be a lapse or what. But I mean, at this point, how's dating going to work going forward anyways? So it's another thing to think about. Sorry.
Thank you for sharing that. Okay, so Dr. Youssef, would you like to comment about sort of what's going on, your thoughts, not so much as the director of the STAR Clinic, but maybe just sort of your personal thoughts and thinking about how this pandemic is going to affect people.
Thank you, Tonya. And I want to thank Fleur for being so candid and open about what's going on. And I think what you're experiencing, Fleur, I think that is echoed across a lot of people. Many people are in your exact same situation. And so, to answer your question, Tonya, I think when we look at what's happening, we're in the middle of a pandemic. At least we're here in New York and we're over the first wave, and hopefully we won't get another wave. We really don't know, but The worst for New York is over for now. But it's left a lot of people in this weird place emotionally, right? So I think first I just want to acknowledge everyone that's out there, because everyone has been affected by COVID on one level or another. And it affects you on a personal level, on a work level. People have lost people they know, people have been sick themselves. We don't know where we're going in terms of what's happening with this pandemic. Is it winding down? Is there another wave coming? There's a lot of unknowns. And when there's so much fear and unknown and insecurity, people have lost their jobs, and there's food insecurity, financial insecurity. There's a lot of fear. It's hard. It's hard to think about your sex life. And it's hard to kind of like get in that frame of mind for a lot of folks, because there's so much stress, right? And stress can be a big factor in terms of opening up for relationships. So I think that's something at play. And with everyone sort of being in this mode of having to shelter in place, for some people it's fine, but for other people it's a little bit risky. So I think everyone's at a different position depending on what their situation is. I'm personally, I'm married. I have a 5-year-old daughter, and I live with my in-law relatives who are geriatric. So my home life is busy and complicated. My work life is very busy as well. But I think everyone's in a different situation. And I think what Flor brings up so many great points. So one is dating and sex was complicated before COVID. We had to know everyone's STD status, their HIV status. We had to protect ourselves, whether it was PrEP, U equals U, PEP, just getting tested, like that was already complicated. And we had to do a lot of messaging as public health and clinicians, right? Now it's added complexity because there's COVID. So now you can get this infectious disease without even having sex with someone, because it's more respiratory transmitted. So you could be on a date with someone in the same room within 6 feet and still get COVID, right? So we have a lot to talk about in terms of how to keep people safe in the dating world, and also what to do when it comes to sex, because there's no clear guidance on how to do that. And we'll talk more about the specifics. And Flor brought up a lot of great points. The safest sex is, yes, with yourself, in terms of sex toys and masturbation and maybe sexting or video chats. And we can get into all those details soon. But that would be the safest thing for individuals. But I think on a personal level, I've seen all sorts of things. We at our clinic, we are still seeing patients with selected on a selected basis. So for PEP, for STIs, including PrEP, and newly diagnosed HIV. So we are on a case-by-case basis because we need to ensure social distancing. So I think if anyone needs care, we can talk more about how to get care later in the program. But there are ways to do that. And
absolutely, and we will be providing that information at the end. Thank you so much. Okay, I can see that Michelle Lopez is just bursting to say something, so I'm going to let you go. Michelle?
Well, my dear, I got a deep breath because I feel as if I'm just going to jump right into one of the first things I want to say. The work that I'm doing at GMAC as a staff there now is allowing me to be able to not just explore, because I have some wonderful things. COVID have allowed me to carry forward some of the workshops that I've always had in my head. And I have a history, yes. The two things that's going on. I am a woman that has been working, with the over 50 population for, I would say, within like the last 6 years. So here I am now, and I've been an educator, but I also to use my life story as to educate individuals, because I feel as if I'm addressing stigma. I'm also looking at a lot of us who feels taboo about our sexual needs as we age. So I'm going to talk about, just some aging stuff in there. And the third thing I'm going to talk about also I'm a woman who I'm very public and open about my HIV status. I'm in my 30th year. And I have created some wonderful educational tools that I'm going to be utilizing, creating workshops to educate consumers about our sexual health, those of us who are aging, and some really neat things. I've said to people, how many of you FaceTime friends and family? Guess what? That's one of the safest and it's the most fun I have been having sex with individuals. It's not about who's penetrating me. It's about being safe, having fun. I mean, I identify as a bisexual woman, so I'm having fun with both parties. But guess what? My sexual health is intact. I have shared it with my doctor. We talk about the things it is that I'm doing, something that I learned, in fact, not recently, but something I learned because I'm very sex positive with my doctors, right? So my experiences, I then create that into workshops that I can educate. I can educate my community. I can even educate providers on, because a lot of providers are very uncomfortable talking to us about sexual health, right? So I am enjoying sex. I am having sex. Sharing toys. I develop a nice little piece called Show and Tell, that I'm doing with, I'm a single person. So I'm dating. So all these are areas that I can touch, I can talk about. And it has, it has its age limits from where it starts. But I'm talking to my aging folks. I'm talking to those of us who are aging, living with or without HIV. There is fun things, the show and tell. Oh my God, I'm having so much fun with that.
You're amazing. Thank you, Mimi.
I'm going to, stay tuned, and I am going to give individuals the link information to my webinar that's going to be on May the 29th. So stay tuned.
Will do. Thank you, Mimi. So now I feel like I need to bring in some of my guys. So first, and I didn't do this in any particular order, but Jose, I would love for you to just chime in here and just sort of like, how is this pandemic and your thoughts and feelings working in this field?
And well, I have very interesting points. Sex in the time of COVID. I'm Latino, we're like, we like it. So
like it,
it's yeah. I mean, how I took it. I took it to it's a time of self-discovery and self-love, and it has worked interesting, and also it made me think how difficult it can be, obviously, because we have nowadays, especially for the gay population, the menu. We can get on an app and we get online, and we literally have a menu of people available right now. So which at the beginning worried me because I was, oh my God, this can be a big problem because a lot of folks in our community there cannot control themselves, and or they didn't take it serious, and also make me think about the sex worker, which is my question here with you guys. Like a lot of people are affected through that, but I think that the most ideal thing, if you don't have a partner, it is, and if you don't know anybody because you know the time of hookups, COVID-19, I think it utilizes time that we're being granted, besides all the terrible things that are happening, to go into this sex love, inner sex, which I think is love yourself, work on yourself if you want to do exercise or do FaceTime, reunite to people. For me, sex is, yes, it's an emotion. I mean, also there's self-motivations that we can do. But I think the most important thing it is to take this time to recapitulate. That's basically how I do it. I was dating somebody, and it was basically somebody that was new to me. As soon as it started, I said, you know what, we need to get a hold. We're getting to know each other, I don't know what you're doing, who you're meeting, and because some folks cheat, and I don't know who he's doing. So I felt like I was at risk, and I do it. I was not afraid to say it because of my health.
To unmute myself to respond. Thank you so much. That's awesome. I feel like right now I want to jump to, and Tracy, I love you so much, but I think I want to jump in because Jose sort of brought up also culture. And everyone sort of in this panel, sort of, we're all representing different cultures, but I want to jump to Damien, because I know Damien is also, you've done a lot of work in terms of our Caribbean community here in Brooklyn. And so I'd love for you to share your thoughts or any thoughts that you might have in terms of your community and the work that you're doing with HEAT.
Okay. So last night I was socially distancing on the porch with one of my friends, and we were just talking, and of course, we started talking about sex, and he's very much like, he's straight man, married, a daughter, and he's like, I'm like, he's like, I don't understand. Why can't people? It's a pandemic going on. Why can't people just not have sex for a couple of weeks? And then, of course, I love him, but in my head, I'm just like, fuck you, no. We've been having sex through other pandemics, and I don't know. I know I had shared some of my own feelings about this with you. So a lot of these thoughts of my own, not heed or what the Department of Health is saying. At times, I feel like I have a W on my. I'm wearing a W here for whore, but I am still sexually active. I do. So I don't want, when this goes live or anybody sees it, they're going to be like, oh, look, I saw this man on the apps and here he is talking about like, oh, don't do this. And, you're your safest partner. When I'm like, that was nice for the first couple of weeks and stuff. Yes. But honestly speaking, ain't nobody got time for that anymore. People want to enjoy somebody else's body and want to have that and that's a need. And I feel like, I feel like when the guidance was written, I feel as though, like from the Department of Health, I feel as though it was written for people who are already in relationships, married, partnered up, and not, like way down on the list was like, if you're going to have sex, I feel like it needs to be, that guidance needs to be updated and say like, okay, guys, it's been 2 months now. Let's be real. You guys, we're going back to fucking. What are we doing? How are we going to be doing this safer? And if you are going to do it, let's just talk a little bit more about what you can do. Like, yes, people, get on PrEP. I mean, before the pandemic, it was a little easier. It was like, okay, if you're on PrEP, it was like, okay, the question was, are you on PrEP or are you taking your pills? So the main question was like, condoms or no condoms still. So now it's like, okay, have you had a cough? What's going on? So you have those questions now to add to it. But again, I just feel as though I still get people saying, or I hear conversations in the clinic and outside, like, people are dying and, you're just thinking about getting your rocks off or trying to just have, your freak on. And I'm like, I want to enjoy myself. I want to, be with someone. And that is something that's still real and it should be acknowledged and, going from that perspective and not something, again, to stigmatize people, minority groups as well, who've already been stigmatized in so many ways. So that's my 2 cents.
Thank you. Okay, so now last but not least, Tracy, I absolutely love you and your participation as sort of our lead. And I love the hat, by the way. Can you lean down so people, yes, thank you. That's our star bling bling, PrEP for sex, thank you. Tracy, would you, because you are in the clinic, and so you have also been dealing with a number of our clients coming in and trying to sort of navigate this. If you would like to share your thoughts, because we're going to talk more about PrEP and stuff like that, but if you'd like to share your thoughts about how this pandemic has just changed things for us.
I think in general, it's changed a little bit, but not as much. People, like everyone else is saying, people are engaging in sex during COVID. Some people are being more cautious and more safe, and some are just kind of just doing it because they just want companionship or trying to fill a void or what have you. It's literally every week I'm getting at least 2 patients for PEP because they were just, I guess, a little too free during COVID. And so, it's changed a little bit, but not as much. There are some
Tracy, can you just explain to our viewers what PEP is as opposed to PrEP?
Sure. So PEP is the acronym for post-exposure prophylaxis, which is the 28-day regimen of medication one would take after being exposed to or perceived to be exposed to HIV. PEP is a medication one would need to get on within 72 hours of being exposed, potentially exposed to the virus. So it's important time-wise that if someone were out there having sex and they were unsure of the partner that they were just with, regardless of what the partner is saying, it may not be 100% true. Really, to cover your own self, that person would seek out PEP. And whereas PrEP is the pre-exposure, so that's the medication you take to prevent any accidents or incidents of HIV transmission. And so, from the patient's perspective, I'm seeing, it's not much change. People are just still doing what they want to do when it comes to sex. People want that companionship, so they're going to seek it out, whether they have a regular partner or not. Recently, we had a patient that came in, and they engaged with someone who they found on a dating app. And, I said, is it really that important, or right now, is it necessary, like during COVID, that you have to seek out sex? And they said, it's not that I have to seek it out. I just want the companionship. So I get it, For me, I'm single. I've been single for a little while. So, being stuck at home, I guess, during COVID is not, it's not that big of a deal for me, because I'm kind of used to it at this point. But I get the other perspective that you want someone around, which I get. My parents are older, so I'm here with my parents. And I get it. I get if you're totally single and living at home by yourself and you're quarantined, yeah, you want that companionship. I 100% get it, but you need to be safe at the same time. So, I always preach protection. I'm not preaching not to have sex. Of course, if you want to have sex, go right ahead, but just be safe about it. Protect yourself, use condoms, use PrEP if you're exposed and things, and that didn't work, seek out PEP. 100%, I'm 100% for being safe and preventive methods.
You're awesome. Thank you. So as we move into our conversation, I don't want to keep all the mics open because there's some feedback, but what you can do is you can just wave your hands, okay? I wanted to start off because I think this is very important that we just start off with some clear clinical information to give to people. So, the first thing is that I wanted to see if Dr. Youssef in particular, if someone could comment on the questions about, is COVID-19 sexually transmitted? And if anyone else wanted to jump in after Dr. Youssef. So, you're our doc here, our top doc, I didn't share with our audience, I am also married and I'm having sex, and I'm very glad that I have a partner, and I realize that I'm lucky and privileged in that regard. I also have 2 kids, which it sometimes squashes my interest in having sex. But anyway, just everyone else shared that. And so, but Dr. Youssef, is COVID-19 sexually transmitted?
Thank you. That's a great question, Tonya. From all the information that we have right now on COVID, and we're taping this May 15th, so it's been barely 6 months, not even actually 6 months since it was officially reported. And the whole world has been examining and researching COVID. From all the information that we have, it's primarily transmitted through respiratory droplets. There have been early studies looking at if if coronavirus is actually novel coronavirus, if it's found in vaginal fluid and seminal fluid. And initial studies said that it wasn't, but some studies later on showed that they found a little bit of coronavirus in feces. And one recent Chinese study found some coronavirus in semen. of patients who were ill with COVID. But it's not clear whether these the coronavirus that they found in the semen was infectious or not, or if it was just genetic material that was just detected. So we don't have a clear transmission of COVID through sex. So at this point, we'd have to say no. But having said that, it's a very new virus. We're still exploring it. I do want to just caution and say that, whether you can get COVID from being sexually active, you can actually get COVID from just being within 6 feet of somebody. And to have sex, you generally have to be a lot closer than just 6 feet away. So if someone had COVID or was recovering from COVID and you had sex with them, you could just be getting it from their respiratory droplets as opposed from the bodily fluids. But that's as much as we know right now. And of course, everything is evolving as we're learning more and more about COVID.
Thank you so much. Yeah, you can't, well, there are different ways of having sex, and we'll talk about that, but absolutely
Exactly.
in vivo physical sex, hugging, kissing, and doing all the fun stuff that we do, it's really kind of hard to do that 6 feet apart. So, Flor, you wanted to chime in here also in terms of just sort of this misconception around sort of it being sexually transmitted, or what do you want to say, sweetie?
Just not necessarily it, not that, but I just kind of I hope I'm not derailing the conversation here, but I would say that the situation has added another layer to trust and how trust works with another person and how you interpret it, and consent. Just because, for one part, when trust is, okay, say you are even, doing self-sex and doing stuff online with people, how can you trust that they're not recording stuff that's going to be put out later? And then, that becomes a consent violation.
Yeah.
So there's one more thing to think about. So whereas you want to go ahead and be free online, you don't know if you can or not because somebody could be recording you.
Yeah.
And, what happens down the line. And then second of all, I understand frustration. Like I completely get it. But for me, I wouldn't go out and physically hook up with somebody because of a what if factor. I wouldn't be able to know that if I hooked up with somebody, was that orgasm worth potentially my parents getting sick if I am now an unknown carrier, if that person's asymptomatic? Like, it was that really worth it? If it's like I've never wanted to kink shame, like I love thrills, but it's me, I don't know if that's worth it to me. And then also I always think, like, if we can figure out how to have sex safely, then how are we supposed to be able to do that if we can't figure out how to get back to work so I can get back on health insurance? I figure that if we can figure out how to have sex first, then we've really just sorted out all the other crap, and now we can go back to work. So, so I'm kind of like, it's almost like, I feel like if I was to go out and go have sex with another person, it's like, screw it, whatever, let the chips fall where they fall. If it happens, it happens. If it doesn't, it doesn't. I'm not good at gambling. So that's just, that's how it sucks and I feel about it. But you know what? If I got to get a new set of batteries, and that's what's up.
Good for you. No, Flora, you raised a really important question around trust. And when we talk about sort of alternative sex, I don't think that you prematurely brought that up. That's a really important thing, especially in terms of using webcam and other things. I wanted to ask the next question, just to sort of keep it, just to get rid of our kind of clinical stuff, for our providers. So there is a lot of attention, or in the last couple of months, about the use of an antiretroviral being used in treatments. And people are familiar that antiretrovirals are used to help people living with HIV, but they're also used with a lot of other diseases. But, on some message boards, I've seen that people are sort of starting to think like, oh, well, they're using an antiretroviral to treat. Maybe I can go get me some PrEP, and maybe then I can just do whatever I want, and I don't have to worry about the consequences of being exposed to COVID. So I was just wondering if any of our providers, maybe Tracy might want to sort of take the lead in terms of, because she's dealing with people sort of coming in for PrEP services, maybe Damien, Michelle, Dr. Youssef, unmuted first. Dr. Youssef, voila.
Okay, I didn't want to steal Tracy's thunder. She can go ahead, but I'll just, but since you unmuted me, I'll just say it. So initially, when COVID first started happening, there were very few studies out there, and the Chinese were actually the ones who first experienced COVID and tried to treat it. And they use a lot of different medications. And since then, it's been several months, and we've had more studies being done. So initially, they looked at Kaletra and saw what they thought may have been some response from that. Other bigger studies, better designed, have been done since then with Kaletra, lopinavir, ritonavir, and have not shown it to be successful for preventing coronavirus. The PrEP medications that we have approved right now is Truvada and Descovy. So it's tenofovir alafenamide and tenofovir diproxyl fumarate, and neither of them have shown any efficacy in treating coronavirus. And in fact, some of the drug companies have put out statements for Persista, as an example, saying that that medication has not been shown to be effective against COVID. So as far as we know right now, the antiretroviral medications have not been proven or established to treat COVID.
Thank you. Thank you so much. Did anyone else want to chime in? Okay, I had sort of a segue question, which I know will fall right into Damien's.
Tonya, dear. It's
oh, did you? Okay, yeah. I didn't see you wave your hand. Thank you for unmuting yourself. Go for it.
I know this is downstate focus, and again,
not necessarily. Not necessarily.
Let me finish. Right? And it's great. This is a great, dialogue and everything. But I also too do have to go back on my work. I have a call at 2. We do a lot of Teams work, so I don't want to be obnoxious. You see what I'm saying?
Yes.
It's a rich conversation. You guys are doing an awesome job. I would have just liked to just touch on, because again, what it is that I'm doing, and maybe I'm just a bit too sex positive for this conversation, because I like to give people, I like to look at, for those of us who are sex positive, who are aging, there are some things that I think that we really can explore and be able to help each other. And I just want to say that's some of my work that I'm doing. And yes, I don't just go pick up people online. One of the things with aging women that I can share, we really have a long history with a lot of the folks who have interest in us. I'm going to use these as just little pointers, So for us, it's really about picking up the phone, reconnecting with that person, and being able, to start some intimacy. I speak a lot about intimacy from a I-person perspective, because many of us are still we're not as comfortable about our body, about our sexuality, there's a lot of that. So I spend a lot of time of that, again, within, because I live my life. And, I've seen things when I share it with individuals who give it a try, and it's working. So
can you share with us any of your safer sex single girl strategies? Like, what are you doing? Are you doing sexting, texting?
Yeah, a lot of it, and it's not just some people do call that sexting, yeah. But I do this whole piece, and I really just get into my comfort level, and I do this thing called show and tell. As I said earlier on, when I disclosed I'm a bisexual woman, I'm enjoying sex with individuals that is very comfortable with me being expressive as I am, so I have history with these folks. And I do a lot of doing things with toys and showing them. And it really stimulates, their curiosity. You know what I'm saying? I have individuals saying, oh my God, girl, I can't wait for COVID to over. I didn't realize you had these skills. You know, things that I can show and tell you how it's making me feel. I get into that voice. You know what I'm saying? I use a voice of honey. This is a voice sometimes gets so croaky, but it can be sexy, croaky, but sexy. You know, and I use it, you know. Some of the men, you know, love to hear it, call them daddy, daddy. And when this voice is broken, it rouses them up, and I say the things. I'm teaching people about taste. Take a tip of the honey, and I taste it, and I show them how I taste it, and I put it other places. We cannot. One of the things, the education I do, I tell the girls, no honey in the vagina. So we can, you know what I'm saying? We can demonstrate on the titties. There are other places that people might like to. The tip of the finger is very, very stimulating for individuals, and I'm teaching folks about that. So it's quite a lot with the show and tell that goes on. It is safe, it is exciting, and anyone can do it. Anyone, you can do it with your male, female partner. You know, it's about not what you do, but it's how you go about doing it. So, okay.
Michelle, I know you're going to jump off it too, and thank you so much, but your feedback and your being so real is so important, and that's the reason why we're having this conversation. Is that everyone in this panel is sex positive. Like Flora was losing her mind, like laughing so hard because it's real. It's real, and I so appreciate you, and I know that our viewers are also going to understand this. Like, sex is important. Sex is important for our health and well-being, our physical health and well-being, our emotional health and well-being, our relationships, and we have to be playful, especially in moments of duress and stress.
Especially stressful time and period that we are going through. I'm being honest. I relieve a lot of my stresses after I have my little sessions with my booze.
So I want to open up one question here in terms of safe sex. Okay, yes, Jose, I'm going to let Jose chime in, and let's just see where this goes. I'll ask my questions later. Yes,
Well,
Jose?
There's other things that you can do. I've been doing. It's also feeding the fantasy.
Yes.
And I think that's extraordinary because actually it get me, like, I mean, it's I guess a new part of me that it's the people that I wanted to. We just been talking and making plans, and we're gonna go there and that. So that's been kind of like as satisfying as doing it. I didn't think about the recording camera, so if somebody appears a video of me, well, I didn't take care of that. But the fantasy part, I think it's very interesting because I don't know. It's just for me as pleasurable as having sex. It's just feeding that part of where we're gonna go, what we're gonna do, and we're gonna do that. I encounter myself in multiple opportunities doing that, and it's something that gets us going, excited. It's sexy, and otherwise, I will tell them, give yourself a hand.
Yes. Very good. Thank you. Anyone else want to chime in terms of safer? I think the fantasy, being playful. Raise your hand. Okay, because I think that most of the folks on this call are not partnered, are single and doing the single Sex in the City thing, and so we also want to give people advice about there is all the things that Jose and Michelle alluded to in terms of using these long distance tools, texting and web and FaceTime and masturbation, etc. But what can we say for the people who would like to hook up? Like what kind of things should we be advising for people if you do want to hook up? And maybe, Flora, you're not going to take that risk. But what could we say for the people that that are living by themselves and they want to hook up with someone? What kind of things should we ask them to think about? Okay, I think that was Tracy. Let me get Tracy first, and then Damien. Go, Tracy.
Yeah, I think for those that are wanting to hook up, finding the need to do so, I mean, there isn't a guideline that says you shouldn't do it. I think you should do it. You should just be safe about it. That's all.
Right.
You know,
And what,
if
what does
you
what does
can't get,
being safe mean?
well, being safe. You know, if you're anticipating at some point going to have sex with this person, right? So in the time of COVID, I mean, there's nothing wrong with wearing a mask and gloves. You can just incorporate it as part of role play, you know, along with the condom that you're going to carry with you. Now you've got to add two more things. You know, decorate your face mask so that it looks like it has like whiskers or something on it, you know.
Nice.
You know, things like that. Bring your lubricant so you make sure that the condom doesn't break, so you don't have to seek up afterwards.
Okay.
You know, carry your own sex kit with you so that it has all of these things in it, so when you're going to hook up with someone, you're prepared. You shouldn't stop. You know, if you want to do it, then, you know, do it. Just be prepared with it. You know, have your backup stuff, you know, making sure that you're well, using the gloves and the mask, you know, if you want, you know, I don't want to say hand sanitizer, but yeah, but that's for afterwards, so that, you know, just in case you're not near a bathroom or anything, at least your wipes so that you have stuff to, you know, take a shower after you're done, you know, why not? Have all of those things with you, you know, bring your own sex toys with you to incorporate it.
That,
You know, so
those
that
are
it's
great
fun
suggestions. Yeah. I want to ask, like, should people be kissing?
Kissing. Well, I mean, if it's a hookup, if it's like a random person, I guess, not random, but if it's a general hookup and you don't normally kiss during that, then I guess you wouldn't. I mean, if you can forego it, then fine, because you're already wearing a mask. You know what I mean? It's like I'm gonna take off the mask and you know, risk getting COVID, I guess. I mean, I don't know. I guess it's personal preference. Like for me, I probably wouldn't do that because I'm already taking a risk as it is, maybe. But some people might say, you know, might do a quick peck. I mean, or do a peck through the mask. I guess incorporate that as part of your role play. I mean, I guess it would depend with personal preference. You know, I probably wouldn't take off the mask. I would just leave it on, and you know, once I put it on, it's part of my routine, I guess.
Right.
You know,
Let's let Damien chime in. Damien?
Yeah, I think, I mean, for me, it's knowing your partners. I have friends that I have sex with, so it makes me feel a lot more comfortable. Is that, I mean, I guess it's more harm reduction that way for me, because again, I don't know who they've been having sex with. So yes, there is that risk that I could get COVID because I am still choosing to have sex. Um, I think that is one of those tools that you should use, like knowing your partners more, being able, feeling comfortable speaking to them about, look, how have you been feeling? Again, COVID can be asymptomatic, but just having that conversation so that if something does happen, that you can inform them. You know, I'm still coming into the hospital, so you know, I have there, you know, there've been people that have been sick, so I have been tested twice, making sure that they know that and that they understand, you know, where I work and what I do.
Yeah. Yeah.
So that they have that information as well.
Yeah.
I mean, it would be, I, Tracy, I hear what you're saying, but I don't know about wearing a mask. That's gonna be a hard one, Tracy.
No,
Yeah.
it has to be, you know, people need to do what they feel comfortable doing. But both you and Tracy raised some really important things, which I've read in terms of suggestions. For example, you know, really check in to know, you know, have you been sick recently? When were you sick? You know, we know that sort of if people have been sick, that like they need to self-isolate for 7 days, come out of their isolation, like, you know, only when the symptoms have improved, Make sure that like they haven't had a fever for 72 hours, and that's without medication. But there's new research saying that like people can shed the virus for 14 days. So maybe that should be the end all cutoff. And going back to what Tracy said about like, you know, maybe taking a shower before and after. And, you know, also thinking about like, am I about to have sex with someone who's at a higher risk? You know, they're a health professional. They're working in a clinic. They're a first responder. They're an essential worker, like taking those things into consideration. So I,
Aren't we
Dr.
aren't we supposed to be showing first healthcare workers and first responders love?
Yes, we do. Absolutely. Besides yelling and singing outside at 7 o'clock, I'm not saying don't be giving folks love when they need it. I'm just saying that we should also think about our own personal risk.
Yes.
And, you know, if we're living at home with our older family members and thinking, well, I could hang out with John or I could hang out with Mike, but wait a second, John is an EMT. Let me hang out with Mike, who's a school teacher at home. You know, I'm just saying that we need to make choices. Dr. Youssef wanted to check in?
Yeah, at first I just want to echo, I agree with what has been said by Tracy and yourself and Damien. So just a couple of things to add to that. So one, you know, the safest sex we mentioned early on with yourself, right? Second safest would be someone in your household in terms of like your partner that you live with. And then third, you know, if you're going to hook up with someone from the outside, is exactly what you're saying, Tonya and Tracy and Damien, to think about, you know, what their role is. Are they out in the community a lot? Are they protecting themselves? Are they symptomatic? Are they getting over COVID? And you laid it out perfectly, Tonya, in terms of the criteria of when to re-engage in sexual activity after that. Whenever considering sex, it's always important to always get consent first, because that's even without COVID, right? We know consent is essential, but particularly during COVID, because not everyone might feel particularly amorous about engaging in sex. Some people might feel a little bit nervous or uncomfortable about it. So you want to make sure that your partner, whoever that is, feels totally okay with having sexual relations. Everyone's at a different place with this pandemic, and there's a lot of fear that some people have and other people might not be at that same place, right? So we want to make sure everyone is on that same page and ready to engage in sex if that's what's going to happen, right?
Yeah.
And to Tracy's point, yes, wash your hands before, wash your hands after. If you bring sex toys, wash them before and after.
Yeah. Mm-hmm.
Think about not sharing them, you know, just, you know, you want to consider all these things. Also, with regards to the, you know, actually having sex, it would be actually a good idea if for someone you don't know well, or if it's, you know, you could never really be too sure about anyone. I think in COVID, it's made a lot of people sort of question and be a little bit distrustful, maybe slightly paranoid, because we don't know how we can't account for everyone and their risk behavior. People could be asymptomatic, right? So it might be a good idea to consider not kissing somebody. It might be good to consider different sexual positions where perhaps you're not face to face. It might be a good time to get creative. Use a mirror, you know, whatever it takes to like kind of like be creative and just think about different ways of having sex that don't put you exactly, you know, face to face. Tracy had a great, very cute, playful idea about the mask and gloves. You could do some role playing. You could do a lot of fun
I might try
stuff.
that with my husband, just for fun.
Right. And then one more thing to say, you know, for our LGBTQ and others out there who may do rimming or mouth to anus activity, because there is some coronavirus that people have found in fecal matter. You know, some health experts recommend against that. So just for now, you know, foregoing some anal activity or anal play, just because we don't know, right? We don't want to put people at unnecessary risk, right? So you want to take extra precautions in all these ways.
Thank you for bringing up rimming and anal licking. Like, would you also say to folks, like in terms of using a dental dam or any?
Yes, thank you.
Is it okay if you have a dental dam?
Yes.
Or should we really, until we know a little bit more, not be licking?
That would be the safest thing, right? But but we have to be realistic, and some people may still want to do that and engage in oral sex. So yes, use a dental dam if you have it, and if you haven't, and that's a sex act you want to engage in, then yes, take all the precautions you can, because we really don't know a lot. And so always consider, as Flora was saying earlier, think about if this is really worth it, if you really want to take this risk, because we don't know. And even just getting to the apartment of your to-be partner, right, for that night, you don't know what risk you're going to encounter along the way, taking mass transit or Uber or what have you. So do be careful, weigh your options carefully. It's a very different time that we're living in right now.
I know. And we'll talk about the new normal. So the next person is Flor, then Jose. Sorry, hold on, Flor. Let me unmute you. Yes.
Hi. I did want to point out that this is probably like an amazing opportunity right now to completely destigmatize testing, because of all pandemics and things that have come out. There's usually been like a fear or of being diagnosed, or even going to get the testing, or looking at how to try to protect yourself. Because I remember early on when this broke out, and I've got some connection to New England, when that cell cluster broke out in Connecticut, there's an article in the New York Times, there's a quote from this lady who said that she didn't want to tell her neighbors she'd been exposed because she thought it was like having an STD. And this is like a huge opportunity now to, like, I think, normalize taking care of yourself and getting tested. And as testing becomes more available to people, because, like, well, hopefully that's the direction it's going in.
Yeah.
That this will become another tool.
Yes, that is so important. And I must admit, like, it's been hard for me to understand the stigma, because part of me is just like, we're all vulnerable. But the truth is, it is one of the reasons why I started out with the question about, is it sexually transmitted? Because it's still carrying that connotation. And I think you're absolutely right. And not only sort of just testing all around, Hep C testing, HIV testing, STI testing, and I think you're absolutely right. Thank you. Jose?
I found something very interesting from my friends that have, they're a couple, but they do.
Uh-oh. I'm losing your.
What is it? Can you hear me?
No, it kind of like buggered up. Okay, try it again. Try saying it again.
I was sharing something very interesting that I saw. It's kind of like called it production. My best friend and his boyfriend, they like to play with other people. They have their scenes as a couple. When this started, they already spoke to those, I guess, friends with benefits, and they say, we're gonna make an agreement that the only people we're gonna see is just ask us to stay safe. And my cousin did that as well, which I saw is interesting, and it's also very smart. In my case, I have a high risk because I have respiratory. I decided even to delete the dating apps, so I don't feel like, tempted. And in my way, I expressing it that, and then with the people that already knew, this kind of fantasy game. But because my question is like, if it's the drop is, I cannot kiss, and how am I gonna be? For me, there's no way, especially by the way that I like intimacy. Yeah, I can be played, but I don't see. I will drive myself crazy with a mask. So in my case, and I do recommend some people, use that time for the self-discovery. There's so many pleasures that you can eat, and there will be great, because it's not me that I'm risking. I can be risking people that are close to me, and that terrifies me as well. Not just the fact that that's why the person that I was dating, I decided, I know that you've been cheating, or you've been going out here and there. So I got to decide that you and I, we're not even get together till this finish, because I'm putting myself in a situation of risk, because I don't know who you are with, and we say hello when we see each other with a mask, and like hug from far away. But it's also, I guess, it's a self-love and self-respect. Yeah, I love sex, but I love me.
Yeah.
And that's something that it's been, in my case, it's been a very beautiful quest, this whole pandemic, because it's a process. It's been a self-discovery in many ways, that it granted me the time that I didn't have before because I was so busy, because I thought about it but I couldn't because I had to do this work or whichever. Now that we were being given the time to give to ourselves, not just to the partner, to the zombie, like to you, like do something that it pleases you. Like I had never had this pleasure of doing yoga, waking up in the morning. I was not a morning person. Now I wake up, I see myself waking up by the time of sunrise, and then doing yoga and sitting down, reading a book, and then exercising. I've never been a fitness person, but I find that's something that I wanted to do for many years. I was never able, never. Or I put myself excuses that I needed to go with a friend. The truth, no, I was doing it for me. And that's something that has given me an incredible pleasure, that for me it's like the sex love instead of the self-love. And yeah, I mean, I'm not a kind of guy who like to play with toys. So that's how I'm feeding my other sexual part, with the fantasy, with the talk, and the self-love, because I know that I can wait and it's gonna be extraordinary by the time that it gets. And especially when you're waiting for something, like it's just like it's Christmas, Oh, it makes it even more sexy.
Sorry.
Okay.
I muted myself. I was just saying that was so important, what you just said about self-love and taking care of yourself and protecting you. And I know that a lot of people have done that, taken this opportunity during this pandemic to work on themselves and to find ways of holistically taking care of themselves. I don't want to take up too much more of people's times because I know everyone is busy, but I wanted to just quickly ask, and my final question will be about our new normal, but I know Flora's got her hand up and I'm going to come back, but something I did not know until recently, and I want to bring this up, is the fact that apparently all of our sexual health clinics, as a result of this pandemic, have been closed down. And it's because a lot of the people working there have been, working in infectious disease, and we've needed to pull these highly skilled people to other places. But, I do understand that some places are doing online consultations, but the truth is this has really disrupted an ability for people to get sexual health care, whether it's about family planning, whether it's about access to PrEP. And I wonder from everyone here, what they think about in terms of the impact that this will have on the spread of other sexually transmitted infections and unintended pregnancies. So I know, Flora, let me quickly I know that Dr. Youssef and Damien wanted to check in, and then I'll put you back in the queue, okay? Dr. Youssef?
Hi. Okay, I'll be brief. There are some clinics that are still open. So, I mean, we are seeing patients for selected situations, PEP, STI, evaluation treatment, and newly diagnosed HIV. And the Department of Health in New York City has a couple of clinics that are open. I know there's one in Fort Greene. I believe the other one is Chelsea, but you can check online. And they have limited hours, but they are available, and they are doing selected services as well, like Jumpstart for HIV, and I believe PEP, and they may have one or two other services, I think contraception and others.
Thanks for correcting that, because I was under the impression that
yes.
It was but a handful, but still you're mentioning a handful, and we should have
right.
Hundreds in the city.
Right, and always call ahead because clinics have less hours and less availability. And there was something else I was going to say. What was the other part of your question?
What do you think in terms of the spread of STIs? Because
yes,
you and I are in the Division of Infectious Disease. There are other STIs running out rampant.
So first, let me. We've treated a lot of we've actually treated a handful of STIs even during COVID. We put a lot of people on PEP even during COVID and PrEP. Less than before, I've had patients who were previously on PrEP saying to me, I'm not on PrEP anymore because I'm not as sexually active. So some people have taken themselves off of PrEP. But two things I wanted to say. We are diagnosing, we had 4 newly diagnosed cases of HIV in the past 6 weeks, even during COVID. So that's still happening and we're still treating them. But I'm worried that people are scared to get COVID, so they're delaying their own care. And we see that happening for diabetes, for hypertension, for other things. And the last point I want to make is about our LGBTQ family and colleagues, because we have a few LGBTQ patients, trans patients, who need to get their hormone injection shots, and some have relocated to New York and are trying to get care with us, which we're setting up. And then we've had some who want to leave New York and go to other places.
Yeah.
And when they go to these other places, they're finding it very difficult to get their injections, which can be very risky because we don't want individuals not using safe syringes or needles, or not getting the access to that service. One patient I know of actually drank his hormone therapy because he couldn't get access to injections. So there's a lot of education and outreach we need to do in the medical community in terms of reaching out to LGBTQ, a population that has pre-COVID been already disproportionately affected with many challenges. Poverty, mental health, social, situations and whatnot.
And at the end of our video, we're going to make sure that we sort of also provide information about our particular LGBTQI plus clinic and how people can get this. I'm very proud that we have that at SUNY Downstate in the STAR Clinic. I want to let Damien chime in.
Yes. So when talking about the city's STD clinics, so at the height of COVID, only Chelsea Clinic was open. Only Chelsea Clinic. They were screening people, limited hours for a city of 8 million, for a city that has how many people who are without insurance, people who are undocumented, who know this service exists. We had that one clinic, and again, to me, it just seemed a little. I'm quite sure there are lots of smart people who have a really good reason for why that was the way it was. But again, I'm like, we're putting out this guidance here, telling people like, yes, do this, do that. But where was that safety net? We're like, you're telling people call in. People are like, look, this is where I go. I know this. It's not open. I was getting calls. I don't have insurance. I need to get a rectal swab. I mean, again, if you have rectal gonorrhea, rectal chlamydia, that puts you at greater risk for getting HIV. HIV is going to be, eventually, COVID will be gone and there will be a memory, but HIV is still going to be around. HIV is still the big bad. 30 plus million people worldwide have passed away. So again, it's something that I know I shared this with you, Tonya, that it just annoyed me and it was upsetting. But yes, they have opened up Fort Greene, but at the same time, I'm just like, we know HIV epidemic in the Bronx. Are we telling people that they're going to need to leave the Bronx to come to Manhattan, getting on the trains? That just seems as though you're putting them in.
Not fair. Yeah. Thank you so much, Damien, because I know that was important. Fleur, you wanted to chime in? And then after that, Jose.
I have had conversations with some friends before, and I was wondering what everybody's thoughts were about the immunity passport, because I feel like some people are like, I'm young, I'm healthy, I can just go ahead and get it over and done with, and then I can go hook up with people because I know I'm not a carrier, or I've already had it and I'm done, so I'm immune.
I would leave that question to answer that question with our doctors or Tracy. Dr. Youssef?
I'll take it. So the challenge with the antibody testing is that it tells you whether you've had antibodies or not to COVID. So if you produce an immune response. But there's a couple of layers here. So one, not all tests we've seen with COVID are completely accurate. I know someone who definitely had COVID. She was symptomatic. She had a positive nasal swab for the molecular test, the PCR, and then she had her antibody test and it was negative. But we know she had it. So, there's that. So not 100% accurate test. And then the other thing is, even if you chose antibodies, we don't know if they are the antibodies that confer immunity. And we don't know if that immunity will last 3 months or 3 years. We really don't know. So think about antibodies. We get antibodies to chickenpox, and then generally people have a lifelong immunity. But people also get antibodies to influenza, but are subject to getting influenza every year. So we really don't know what it's going to be like for coronavirus, for COVID, because it's a brand new virus. We haven't seen it before. So there's a lot of unknowns here. We really don't know if your antibodies are positive, what does that mean? In fact, SARS, which is the closest thing to COVID, people seem to be immune for a couple of years. But we really don't know, and we're not going to know for some time. So these immunity cards could give people a false sense of security or a false sense of hope. And we also don't know if someone can get reinfected. That's going to be the other thing that we're going to have to look into. And there's a criteria for declaring someone reinfected, but it's a little bit stringent and relies on testing. And testing has been so limited here in the United States, in the world in general. But so it's a challenge, and we really don't know the answer to that, Fleur. But I'm concerned that, to your point, people are going to get falsely reassured, go out, get exposed, potentially infected, and then pass on this infection. And the more it keeps getting transmitted, the longer it's going to take for coronavirus and COVID to end. And my daughter keeps telling me every day, when coronavirus is over, we're going to do this, we're going to do that. And I'd love to, but I don't know when that's going to happen. And it depends a lot on human behavior and how fast we can all kind of, socially isolate and just get this done, or physically isolate, I think is the proper term we should use, because we don't want to socially isolate ourselves, but at least physically distance ourselves is what we should be doing. You're muted, Tonya.
Well, I have a question that actually a lot of my friends ask me as well. So, should I keep taking PrEP if I'm not doing anything?
Good question.
I mean, because I know there's a medicine that can have side effects. I stopped personally because I know I'm not doing anything. So, is that the right thing to do? Should I keep taking it, or should people stop taking it? That's something that I just didn't find just myself. Like I have friends that asked me to. Should I keep taking it? I didn't know what to say. Just ask your doctor. But I mean, now that I have you guys here, and a lot of people, they may be asking the same question as well. Should we keep taking the prophylaxis?
Right, and I also want to, Fleur, did you have a similar question? Because you are all were you taking PrEP, or are you still taking PrEP?
I am still taking PrEP. I was just gonna finish out my bottle, and then I just, based on insurance and trying to sort everything out at the moment, trying to figure out where to go from there. I'm not having sex. I know I would need to take it for a month to be protected again. So depending on when I do choose to have sex, I've got another month to wait. It's something, I don't know. You just really got to sit down and think about it. If there's realistically, just hypothetically, it's a 3-month period getting out, I'll chill on taking it, and then hopefully by that time we'll be back. But we probably won't.
We won't. Yeah. I want to let Tracy answer this and I'm so grateful that both you and Jose, and I'm really grateful, Fleur, that you agreed to participate in this, because Fleur, do you self-identify as heterosexual or bisexual?
It's honestly, at this point, it's just, if somebody's cool, I'm down. Yeah.
Okay, but when I first met you, you were one of the very few heterosexual women that I knew who was taking PrEP, and so I love that you're also representing sort of the use of this medication among a population that doesn't understand that they also can use it. But both you and Jose have raised very good questions about PrEP, about continued access to PrEP, and also about should I continue taking it? I want to let our PrEP expert, Tracy, answer this question.
So yeah, you know, where our program is one of a few programs throughout the city that's kind of financed or funded by Department of Health, where for those people who are in that insurance coverage lapse or where the PrEP program, we're able to provide PrEP ongoing to those patients. So we access available. Granted, it's not everywhere.
Hold on a second. Well, there's
Sure.
a little bit of feedback. Can you repeat what you just said? Because there was a little bit of whatever, and this is very clear, and we'll just see if we can get through it again. If you could repeat your answer.
Sure. What I was saying is that our program at Downstate, the STAR program, our program is funded by Department of Health, and we are one of maybe about 10 PrEP programs scattered throughout the city, where we're able to provide PrEP to those patients who are in that kind of insurance lapse or don't have coverage, or who are afraid that, you know, who are kind of in your same situation. And, you know, where I'm proud that we would be able to help individuals like yourself and others who want PrEP and somehow feel that if they don't have insurance, they can't get it, or set up, or in this kind of dilemma where if I start, especially for women, if you do start, I have to literally build it back up in your system for about a month, and it takes a long time, and you may not have insurance again for quite some time. And so our program is really was really designed for individuals like yourself who are in that kind of I don't know, like a rat hole, I guess, where you're faced with these issues that if you stop, you're going to have to, you know, build it back up, and there might be some time where you're not sure you'll be able to get coverage, you know, for PrEP, and PrEP is important to you. So, you know, I'm really proud that we would be able to help individuals like yourself to get PrEP, even if you don't have insurance coverage. It's always, it'll be available to you.
All this. So you guys are amazing, and maybe we should really have a Sex in the City with COVID part 2, because I am very pro-sex, and I think that this is really an important conversation. There's going to be a new normal, and we don't know what exactly that is going to be like. So I don't want to take up more of your time, but I'd like everyone to have an opportunity to sort of conclude in terms of their thoughts right now. And Jose and I will work to see if we can reconvene this conversation and absolutely get Michelle Lopez back, okay? So Damien, you had something that you wanted to say?
I just want to say again, if you've lost your health insurance, if you can't access it, there is still Gilead's medication assistance program that's out there. So no one should feel as though they can't access PrEP any longer. To Jose's question about whether or not he should ask whether or not his friend should stop taking PrEP, I think that's a really difficult. That person really has to look at themselves and be honest about what they're doing. I'm on PrEP still. I'm doing it 4 times in the week, so I'm doing the T's and S's. But if it's happened, I at least I want to know that I'm protected on that count. And again, I think the last thing I just want to remind people is to be supportive of individuals, whether they be family members, or clients, about what they are doing sexually. I've one of my close friends already told me, "You're gonna kill your mom." You know, I'm like, no, that's not helping me. That's not that. Try to definitely understand where I am, where that person is, that they're not going out there to be malicious and like, fuck them, I just want to get my rocks off. It's like, no, this is me working with who I am, how I am living my life, and not here trying to kill anyone.
And it's human. It's a part of our humanity. We are sexual beings, and we should not forget that intimacy, physical intimacy, spiritual intimacy, connecting with another person is truly crucial to our health and well-being. So thank you. Dr. Youssef, would you like to share some final thoughts?
Thank you, Tonya. Yeah, just a final thought, if anyone's out there who, feels like they're at risk for an STI or may have symptoms, or in need of any medical care, please don't delay that. Reach out to your provider. We're still seeing patients in our clinic for PEP, for PrEP, for hormone therapy, for LGBTQ care, and newly diagnosed HIV. And we can do other Zoom telehealth visits for non-urgent things. But please seek out medical attention, because we're at a point in New York where the COVID cases are down significantly. Things are not yet totally reopened, but no one should delay their own health care, because we don't want to end up resolving COVID only to come and find crises with STIs and HIV and start from scratch all over again. We've made so much progress over the past decade plus. So contact your doctor, contact Department of Health, contact us. We're here for you, and we're ready to provide care. Thank you.
So important. Thank you so much. Flora? Any final thoughts?
Everybody be safe, be healthy, take care of yourselves, be happy. And I hope I start having sex again.
I want you to have sex again soon, and I want you to have good, safe sex.
Yes, and listen to people, trust and consent.
Trust and consent. And we didn't discuss enough about like the whole videotaping thing, but for our viewers, that is something that, Fleur raised at the beginning. And be careful sending images or videos out of yourself, because people may abuse and misuse that information. And if you decide to do something live, really make sure that it's not being recorded and that you keep yourself safe. So thank you for bringing that up. And maybe we can have another conversation when we do part 2. Tracy, can you chime in? Why can't I unmute Tracy? Okay.
Yeah, I was just going to say that, don't stop, I guess, engaging in whatever makes you happy, especially when it comes to sex. If you don't have a partner, there's self-exploration. If you haven't tried, masturbation or using sex toys, now is a good time to start or to learn about it. If you've never looked at, porn before, there are lots of websites that someone can go on to just watch porn, if you're by yourself or even with your partners, whichever, it's a good time. This is a good time to kind of to find your own niche when it comes to sex and sex exploration, what makes you happy when you're by yourself, opportunity to do that. And, if you've never used sex toys before, there are small little things like bullets and rabbits that someone could use for a woman, and other toys for men that they could use as well. It's a good time to start small, and then you might like it. Some people kind of get a little squeamish or a little bit standoffish when it comes to, pleasuring themselves, but it's important. It reduces your stress. It helps with build your confidence in yourself. There are lots of different things someone could use. So, if you don't have a partner, and when you do get your partner, at least you'll be ready and okay, now let's enjoy ourselves,
Get busy.
So definitely take this time to find your own sexual exploration and enjoyment.
Thank you. Thank
That's
you so much. Jose, you have the last word. and then we're going to close. Thank you.
Again, as a Latino, as a gay, we know in our culture, we are like, it's gonna sound very bad, and I know it's not politically correct, but they say that for gays, a blowjob is a handshake. So which is kind of true. I mean, I'm sorry, we're talking about sex. So take the time to love you and to self-discover. We can give plenty of pleasures, and then I'm gonna taste much better because you're adding the spices little by little, and then you let it grow, and then when you pick them up, yum, the dish is gonna taste very delicioso. And if you have to do it, I mean, be smart. Like I'm terrified of hooking up because I know like how the guys are. Like, so I don't know if he was with the person and he can tell me, for God's sake, anything, and I will trust. So please, for you and for those that you love, stay safe and love yourself. And the other one, give yourself a hand.
Yes, give yourself a hand. Thank you so much for our first Sex in the City with COVID-19 panel. This is Tonya from Star for Brooklyn. We're going to provide some resources in terms of places to go to get more information about sexual health and well-being, about PrEP services, especially for our LGBTQ community, testing, etc. And I just want to say thank you for listening to us, Star for Brooklyn. We want everyone to be healthy for you. Please stay safe and healthy. Thank you. Wow, that was an incredible panel. Oh my goodness, we have to do this again. So look out for the second installment of Sex in the City with COVID-19. Thank you. This is Tonya from Star for Brooklyn, and stay safe and healthy. So be healthy for you.